The Libin Institute has a new 5-year strategic plan that we're really proud of, and it's our grand challenge to reduce the burden of suffering and premature death due to cardiovascular disease through innovative and transformative research. Vascular disease is one of 2 foundational priorities. About 30% of the population will have a heart attack or stroke sometime during their life. 9 in 10 Canadians have a risk factor for vascular disease. About 1/6 of all healthcare costs in our country are related to cardiovascular and vascular disease. So it's something that we pay a lot of attention to. Research is pivotal to everything that we do. One cannot provide great clinical care or great education of the next generation of researchers and clinicians without a backbone of research.
I was 28. I was at work and started feeling like sharp stabbing pain in my chest. Wasn't terribly bad, so I just kind of ignored it, but it progressively kept getting worse. Basically, when it hurt so bad, I said it's time to go to the hospital, see what's going on. They rushed me in, started getting leads on me right away, started doing ECGs. Saw multiple doctors coming in and out, and they were trying to figure out what was going on. Hoping I was going to make it out of the hospital. I wasn't sure if I was going to, and kind of wondering, is this your day?
So vascular disease means that the blood vessels in your body are getting stiffer, and that's usually due to a buildup of plaque through a variety of reasons: genetics, diet, environmental factors, high blood pressure. When you have stiffer blood vessels or narrower blood vessels, there's less blood flow. When you see a patient in clinic, you realize what you don't know. This is where I see the clinical world really intersecting with the research world, because this is where we get our questions from. The clinical world then turns to the research world, which then sets up studies, does investigations, performs trials to try and answer these important questions. And then once we get those answers, we turn back to the clinical world, apply this in clinical practice, and see how well it works.
Vascular research focuses on primarily the blood vessels in your body, which are responsible for carrying blood from the heart to tissues and then from the tissues back to the heart. Our research focuses on the function of these tiny blood vessels that are present in the body. These blood vessels are often affected early in the disease process, and they often drive the complications that lead to things like heart attack and stroke. One of our projects involves using tissue from patients undergoing coronary artery bypass surgery, which provide very informative data for us.
One of the biggest lasting issues is having to take medications the rest of your life. Other things is you can't do all the exercise you wanted to anymore. I think the technology just keeps getting way better and less intrusive.
Resources are limited, and we depend heavily on external funding from governments and non-government organizations, as well as philanthropy through the public. And with all of those working together, we can definitely push the boundaries, create the knowledge that will ultimately have the most benefit for patients. Without the knowledge creation, you can't have new discoveries and new therapies.
It's important to know heart health because, I mean, there's people out there that care for you, and you want to be around to be with them.
I think that we are very fortunate in cardiovascular medicine. The incidence of heart attacks has decreased by some 60% over the last 30 years. It's still the leading cause of death, and we have a long ways to go, but research has really fueled that decrease in events. And without that great interaction between the community helping us to achieve our research and educational goals, the university and Alberta Health Services, is that we're not going to get to be where we want to be. The monies that are raised from things like the gala or other fundraising opportunities allow us to provide the very best in academic health care in our city.